Thank you so much for introducing this paper. And this paper is co-authored by five researchers, leading by Professor Maria Floro. And I have the privilege to present this paper today. I thank all the co-authors for their efforts. I really enjoyed working with them. And let me start. So this is the slide outline of today's presentation, and I'll just move on to the introduction part. Okay, to start with the introduction, we discussed hard to trying to solve the following care conundrum in Korea. And the Korean society has faced the continued provision of family care for the frail, elderly, and young children, while observing the ample supply of paid care workers. So, so why is it? Why families are continuing to give more care, covers the lion's share of total care provision. Maybe a possible explanation for this is that families, maybe the primary caregiver in particular, are willing to take care of their own children and elderly relatives. Or maybe it is true that these households are in care work constrained. So maybe the primary caregiver would prefer to spend less time in caregiving and reallocate their time to other activities, but they are unable to do so. But to date, however, there is no study that empirically examines whether or not unmet demand for childcare or other care exists in the household level. So we argue that in this paper, an analysis of preferred amount of time by primary caregivers in relation to the actual amount of time they spend in care work can provide a deeper understanding of their current dilemma and hardship. So why looking at the unmet demand is important. Um, this issue never have been charted in the literature domestically in Korea, and the relationship between the paid care service and the family care work is still ambiguous. Whether these relationship can be substitute or complement, and we don't know how much of care, especially the paid care service, are needed to accomplish a quality care. And the another side is that the family caregivers' perspectives have been neglected in the literature. So caregivers' attitude toward the caregiving has taken for granted. So many literature just presume that the caregiver are always willing to provide care, but we don't know that whether that is true. And we actually observe some changes around this care situations in Korea. And the changing trend of Korean family structures and the expansion of the public care provision has been observed since 2010. So defamiliation of care in the society has been progress. As a result, we observed real expansion of public care provisions like LTCI expansion and coverage or implementing universal child care system. And simultaneous, there are some signs of changes in idea of gender role within the society. So many has changed, but the families are still performing the lion's share of the caring children and older member in the household, and they report that caring is difficult and not easy a task. So maybe we need a new approach in dealing with this issue. So this study actually aims to fill the missing information in the household's need for support in childcare and elder care. Previous studies have focused on measuring the actual time spent by household members in unpaid care. Our paper adopts an approach that differs from the previous research because it makes use of data on the preferred amount of time that primary caregivers would willing to provide and compares this with the actual time spent on caregiving. So using the perspective of primary caregivers in the household, we measure the amount of actual care time. Also, we measure the preferred care time of primary caregiver and estimate the gaps between those two. And also, we measure the amount of spousal actual care time, which was reported in perspective of a primary caregiver. And also, we estimated the perceived shortfall at the household level of the care time, and also explore the determinants of that gap, which is presented as a PCG and PCGH respectively, and testing the association between the factors like attitude toward the traditional gender norm and socioeconomic status of household. So data is same as that was presented in the first slide, first presentation, but we have 1,001 households, including childcare households. So respondents in the elder care survey are identified as primary caregiver of an elderly member, and those they can be either elder elderly spouse or daughter, son, or other family members, like in-law relationship. And the primary caregiver of a childcare household are those who have child under age 9. Um, so these are the descriptives, but I think I have no time for this explaining the this sample description. So if you have any question, I'll come back to this. So I will go through the estimating how we estimate the perceived care gap, which is PCG, and the perceived care gap at the household level, which is PCGH, and explain about the descriptives. So table 3 shows the results of PCG for the respondents, the primary caregiver. To produce PCG, we used AC and PC measures. So AC, actual care, amount of actual care time, is presented as AC. And to measure the PC, we used a survey item that questioned, if you can choose, how much hours would you prefer to care for your older member or child per day? And we asked them weekdays or weekend separately. So the PCG here can be either negative or positive, or can be zero. So the positive PCG indicates that the primary caregiver is over caring, spending more access time in caregiving than what she prefers, even when there is a support provided by others. In other words, the size of the positive PCG is the gradient that the respondents would prefer to shift some of their care workload to other household members and to also, or they could outsource it. A negative PCGs, on the other hand, indicates the respondent would like to allocate more time on caregiving. But as you can see, this average size of PCGs are positive. That means they are overworking about 26 hours per week, and in childcare, 20 hours per week. So we do have some respondents who showed a negative, or some who had a zero PCG, but they were only like 10% in the sample. So almost 90% was in the positive side. So as the PCG estimates 26 hours for the elderly and 20 hours for the childcare, these access time spent per week on average, it clearly shows that primary caregivers in Korea are spending much more time on care than they prefer. So it could be this can be a sign of unmet demand, unmet needs of care. And let's move to the table 4. This is about the spouse. So we measured the similar way the PCG, SPPCG with the previous slide. At the table 4 is the the negative PCG indicates that this was reported by the primary caregiver, then not the spouse himself. So this number actually indicates that respondent would prefer their husband allocate more time towards the caregiving, and while positive PCG indicates the opposite, so the spouse is providing more care than what the primary caregiver expects. But unfortunately, as you can see, the numbers are all negative. So it means that spouse's contribution in caregiving falls short of those preferred by the wives, as indicated by the negative signs. So about 3 3.3 hours per week And for the child care, the, the husband, 7 hours per week are the shortfalls, the size of shortfalls. And then this is unmet expectation of a primary caregiver. Especially interesting is that for elderly care, if they are using more using paid care services, they are asking their husband to spend more than those who do not use paid care. And also in childcare, even if they use paid care services, so they're sending their children to nurseries or daycare centers still, compared to the not users, still mothers are asking their husband to spend about 7 hours per week more than they are doing um, at the present. And taking into account both the access care time provided by the primary caregiver and the shortfall in husband care provisioning, we estimated the perceived shortfall in care provision at the household level. This is signed as a PCGH, and by using this following formula. And overall, perceived shortfall in care services at the household level is approximately like 17 hours per week on average. And if we break it down by type of care, the elder care is shortfall is much larger, like 22 hours per week, and the child care is 12 hours per week. Um, Potentially, this gap is unlikely to be filled by other older children or grandparents or siblings or other relatives, because the low fertility rate and the fact that the multi-generational households are no longer common in Korean society. So therefore, the key solution to address the size of this PCGH is to utilize more hours for the paid care services. So if we assume that the outsourced or paid care is perfect substitute for the family care, the perceived shortfall can be constructed as a size of demand for paid care service. So demand for paid care service. For some households, they are already utilizing paid care services and still report the positive PCGH. It indicates that the portion of demand for paid care remains unmet. So the size of the unmet demand for paid care is about 17 hours per week. So next question is that what factors actually associate with the size of the VCG or PCGH? We examine the relationship between the level of PCG or PCGH and the factors that can influence it by using the Tobit model. The topic also for elder care is presented in table 6. As you can see, the size of PCG or PCGH was significantly associated with the income level and
Décalage horaire, quoi.
and
Qu'ils soient à moins 5 heures.
sorry. Sorry. Yeah. Oh, sorry. I was kind of disturbed. Okay. Let's continue. And the having another adult in the household was also associated with PCG, PCGH. As you can see, the low compared to the high income group, the low income group has more larger PCG or PCGH. And if you have another adult in the household, actually PCG and PCGH can be reduced. As we move to the childcare situation, the more you can see more variables are significant, and this time the income is also associated with PCG or PCGH, but this time the middle income group is vulnerable group. Identified as a vulnerable group, and education level was associated with a larger PCG. So more educated mothers have larger unmet demand for care. And as for the regions, the rural areas are having more difficult. The household with the rural areas are having more difficulties with a larger PCG or PCGH. But if they are using paid care services, actually it could reduce the size of the PCG or PCGH, and having another adult in the household also may could help them to reduce the PCG or PCGH. So summing up our result for the yeah although the government subsidies covers a large portion of the LTC insurance cost or and it's actually operating the universal childcare services, still the income, insufficient income, seems to matter in the unmet in this with in relationship with the unmet demand for care. So middle to low income families in elder care are a vulnerable group, and middle income families in the childcare was identified as a vulnerable groups. And this situation is likely to be worse among the elderly household where the wife takes care of their frail spouse. Um, in childcare settings, in particular, actually PCG and PCG decreases when the household utilize more hours of paid care services. So many might simply think that paid care service is the key solution to the minimized PCG or PCGH. So we should send our children to nurseries and daycare centers for longer hours, and then the problem could be solved. But if the goal is to improve gender equality and at the same time reduce women's unpaid care work and increase their participation in the labor forces, I think we should be more cautious about thinking about just sending them longer hours in the uh, utilizing more hours, the paid work in this childcare situation. The fact that spouse PCG were no different between the paid care users and non-users in the childcare, it seems that mothers would like to see greater participation of fathers in childcare as another solution. So searching for optimal balance between parental care time and the paid care service hours is crucial dealing with childcare needs. Also, geographical location is another factor that determines the level of unmet demand for care services. In case of childcare, the household in the rural areas experience larger unmet demand compared to those in the urban areas. And in case of elder care, initially the regional factor showed significant association with the PCG or PCGH, but as we control the other family members in the household factor, the association actually disappeared. So that means regional factor disadvantage in the regional factor was compensated by the family members in the elderly case. So geographical issue is still there. And this lack of care service in small towns and rural areas can lead to a vicious cycle. And our result demonstrate the shortage of care service could result in greater care burden and on families, which then push them to the migrate to bigger cities and further exacerbation in the depopulation of rural areas and making it costly for daycare centers to operate in these regions. And the gender norm effect on the unmet demand for care, we were not able to find the association in this study. Actually, the socially ascribed role of a woman as a primary caregiver has been widely dominated throughout the history of South Korea. So we wanted to see whether the gender norm have any effect on size of the unmet demand for caregiver or on their household. However, our results do not show any effect on that. So it is possible that respondents may have already internalized their gender role as a primary caregiver, or they are doing care because they think this is the best way of achieving quality care and meet the needs of their loved ones. So maybe further study might needed to estimate more precisely about the relationship between the gender norm effect on the unmet demand. And more policy implications has been discussed in the paper, but I think I'm done here today. So if you have any questions or comments, um, we'll be happy to collect today.